Hi, I'm Daisy,
Hi, I'm David.
and we're the MSA Crusaders.
Welcome to another episode of MSA Crusaders. Today I have a special guest, my wife, Assistant Knox, otherwise known as Suzy. Welcome, Suzy. Daisy's not here with us today. She's having some treatments, medical treatments, so I am flying solo. And who best to be by your side other than your spouse or your caretaker? Both A and B. Um, Suzy, we spoke about last over the last couple of weeks. I mentioned my pneumonia several times about how it was unseen. Nobody saw it except for like one hospital, and I wanted to touch and show people. My YouTube channel, for example, is dedicated to actually showing videos and giving information about what MSA is, how what it smells like, what it looks like, what it sounds like, what it tastes like. The last two pneumonias we had before my shoulder surgery and after was definitely a telling moment when I look at myself now and wonder every night, do I have pneumonia? I mean, we were just talking the last couple of days, like, am I actually sick right now? Because, not just the blood pressure, but we had some blood tests that came back negative or came back positive, which makes you wonder. So you were fortunate. The one thing you do very well for me, and I've asked you to do it plenty of times, is to videotape me or record me or take pictures of me so I can show people whether it's walking in Paris, or cruise ships or anything, even eating. You've been very good at documenting the, the goods and the bads of MSA, and that's something I wanted to show today. So we've been married for 22 years, almost 23. And so we know each other pretty well. You do have a history in the medical field. My daughter has going to college for nursing, our daughter. So we do have some medical experience in the house, which is good, thankfully. First of all, question would be, how do you know when something is wrong with, now we're not giving medical advice, but there's a difference between being sick and being sick with MSA. How do you know something is wrong with me versus just it's just a normal day?
The first time that we have to call the ambulance that morning, you usually have some pain, some discomfort. I sometimes help you a little bit to get up from the bed, from a laying position to a sitting. But this morning, you told me you couldn't move your hips. And I was very worried then because you said, I can't feel my hips. I can't move them. Everything hurts. And so that just hit me like, that's not normal. That's not okay. So I said, okay, well, let me try to help you sit up. And when I tried to move you to a sitting position, you almost cried and you said you couldn't do it, that it hurt really bad. My only option at that point was to call an ambulance because I knew that I wasn't going to be able to lift you, to get you up, to get you in the car, to take you to the ER. So the difference, to answer your question, is that you had that different hip pain and you couldn't move at all. And you were saying that it hurt really bad. And your speech was a little bit slurred at this moment.
More slurred
More
than
than
normal.
normal. Yeah.
Yeah. What was there any symptoms that you noticed besides that? Like, I mean, pneumonia is having the flu times two. Sneezing, coughing, congestion,
You had
or
nothing.
whatever. Right.
Nothing, absolutely nothing. I even checked your temperature. You had a completely normal temperature, so no fever, nothing. You weren't coughing, you weren't sneezing. The girls weren't sick. I wasn't sick. So it's like there was nothing that would point to a cold, a flu, pneumonia, obviously. Nothing. No
Yeah.
signs.
Yeah. And that was early in the morning too. That was probably 9 or 10 o'clock in the morning, I believe it was.
Yeah, because I had come back in from work. So it was like 9, 10.
Which is amazing because I believe Sophia turned me on my was able to turn me on my side, trying to help me get up, and that was some brutal pain.
Yeah,
You say brought me to tears. I mean, in 23 years, how many times have you seen me cry because of pain? I mean, I've
that
had
often.
many surgeries in my life. A lot of things happen. Tears is something you don't normally see from me unless it's very severe. So I guess that would probably be a big indicator that something's wrong. We did have a couple of videos. I wanted to show how it started. Now this is you know this was pre-surgery. So we can't blame shoulder surgery, hospital, medication, pain meds. There was no pain meds. I have pain meds, but I usually don't take like a lot of them at nighttime or anything like that. So we can't blame any
Mm.
medications for this or any treatments. I want to show this to our viewers, and our listeners can obviously check us out on YouTube or even Spotify if you want to see a presentation. Let me grab a screen real quick, and we'll kind of go from here. This was that morning. Obviously, you trying to help me, and I want to give a really big shout out to Gold Peak Tea. As you see, it's on my nightstand, and this was the first time that I actually said okay to an ambulance.
Yeah.
Now I forgive everyone for having a little bit of butt crack there, but this is as you explain to them that MSA is similar to ALS. And this is the first time it's ever happened. I can't move. And towards the end of the video of the next one, um, you you actually double clicking is hard for MSA people. The next video was you trying us trying to say, well, what are we going to do and get out of here? They ambulance people go and get their little gurney, their little seat, and there's only I can move my arm, and that's about I could barely speak. And look at how much this takes out of you trying to lift someone up. The pain, the stiffness, the body's not moving. And at this point, we understand we have to get up or they're going to pull me. This is what you normally do to help me up. Unfortunately, the neck has to take the brunt of the force. Um, this is how I normally get up with my wife. She helps me get up. Not so much as labor as this, but when you can't move, right? Thankfully, I have you know two great family members, well, three, including Audrey. This stiffness is something that you see with MSA a lot. Rigidity, a lot of things, and it seemed like it was like times 10 or times 20 because I couldn't move anything.
Yeah, since you've had these symptoms in the 4 years, I've never seen you that bad, where you literally couldn't move. Yeah, I normally help you up like that by your neck, but usually you can move more, help a little bit, and you just couldn't at all.
Yeah, we help each other, right?
Yeah.
And there you go. So they grabbed me underneath her. Thankfully, these guys have some strength,
Yeah.
which is really nice. Um, and that was my first ambulance ride to the hospital, which which was very interesting. And again, this is broad day. You can see my face, like I'm completely out of it. You don't see this face very often. Maybe post surgical when you're having anesthesia done, but I say I had no idea we had full fledged pneumonia, and then we go to the hospital and they have you're taking video, not to make fun of me, but you're taking video so you can show me how bad it was because you've told me things that I did in the hospital that I do not remember. I mean, some were funny, hysterical things, but it seems to me that, well, we know that I was losing a lot of oxygen, right? How many, my respiratory rate was between 4 and 6 per minute, and it should be between 12 and 16 breaths per minute, right? We already know that I'm good at breathing in air, but I'm horrible at breathing out air. We know this from other pulmonologists we've seen, including this past Monday. So these videos I do want to show, what it was like. I mean, this is a picture of me going for pre-surgery. What do you call this? Pre-surgery
Testing, the pre-op?
Yeah, pre-ops, right? Pre-ops. Does that look sick to you? I mean, does this person look sick to you? I don't know if that was breakfast or the waiting room, but no. I mean, these are all within the same span. Does this kind of trying to smile face look sick at all? I mean, there's no red nose. I mean, yes, I look like I have MSA, but I look very healthy. And even enough before surgery, the first time that I had pneumonia, they caught it. How does an anesthesiologist catch me with a 104.5 degree temperature and I look like this? She saw 4 beads of sweat on my forehead. I can't believe that a doctor caught that just by anesthesiologists, not the nurses, not the doctors, nobody else, the anesthesiologists, right? So let's play a couple of the videos about the talking that you're doing with me, so people can hear.
Hmm?
I'm fine.
You're feeling fine?
Fine.
Do you have any pain?
No.
Nothing hurts? Typical stuff?
Yeah.
Are you sleepy? Open your eyes. I can't see your eyes.
Now, I don't know how you translate that and get it right. I don't know how. We interview so many people about MSA, and it's so hard. Everyone has their own distinct slurring and, the speaking.
Because
I
I know
don't know.
you.
Yeah, I don't know how you
Nobody
got
else
that.
understands. I have to translate for everyone.
Now, this was before I even got any medication.
Yeah, you had just got into the room. The nurse was checking your vitals. She had just
Yeah,
left out.
right. And we are just sitting here. This is the best it gets in the hospital, right? I mean, they literally were at this point. The clinical notes were calling this pulmonary failure at that moment that they saw me. Full pneumonia, and got me some antibiotics. They said, go home. What I remember was they said, take 2. And this is post surgery. You see my sling. But the first one, they gave me 2. We have videos of the first one. The first time they gave us antibiotics, they said they gave me 2 shots of morphine plus medication and said, this is, we don't know how to treat this, correct? I mean, this is MSA, what can we do? Well, they gave me antibiotics, went home, we rescheduled, surgery and things like that. And we come back the second time, 3 days later,
After your surgery.
take another ambulance ride, which I'm very happy that I finally gave in and I finally gave in and said yes to that. And you took something very the worst. If you remember, Suzy, at the Mayo Clinic, I'm going to pick your brain because I haven't told you this question yet. When we saw the doctor at the Mayo Clinic, he asked if I had one symptom in specific, and he says if you have this symptom, it's bad news. Do you remember what that was? I'll give you a hint.
The breathing, the
Stridor.
stridor, yeah.
Yeah. Now, stridor is usually very high and harsh sound. It is your lungs narrowing so much that you're basically whistling. Now, we've also talked before. You see, like my surgery cut. We've talked before about how my throat muscles, diaphragm, everything is so at a bare minimums. It's so weak that they gave me Botox to strengthen these things. And you're taking a couple of videos of my speech and my breathing. Now, there's no pain meds on this, right? This is literally being delirious from your lack of oxygen, pulmonary failure. And here you captured one of the best sounds of something that says you have a problem. Listen. So it's easy for someone to say that this is mucus or saliva or whatever, but you've never heard this sound from me in 23 years.
And you had no cough, you had no mucus, you had none of that.
No
When I heard
sneeze,
that,
no.
I was very scared. And the reason why I recorded it so you could hear it afterwards. But it was, I've never heard that before.
Right? I couldn't believe, and ever since the pulmonologist at the hospital said you can't leave unless you have a non-invasive ventilation machine, we call it BiPAP. We're contradicting which one it is,
Well, you
but
had a BiPAP in the hospital. In the hospital, you did have that big machine. That's
big
BiPAP.
one.
But this
Okay.
one is the NIV or non-invasive ventilator.
Yeah, the machine in the hospital was like a Terminator, and it was forcing air up and down me. I've never seen something like that, but I've never felt that much pressure in my life. Must have been how bad it was. But this right here was, if you remember the doctor's notes, my upper three parts of your lungs, upper lobes were aspirated with fine liquid like water and coke and stuff like that. So they were full, and the bottom of my lungs, my bottom lobes, were basically collapsed. So I was only breathing on 1/3 of my lungs. And I've mentioned to you before, and the pulmonologist about when I used the NIV, non-invasive ventilation. So when I'm laying down, sometimes my throat muscles are so weak they spasm open and close. And I think that's what the sound was exactly my lung muscles fluttering because they're so weak.
Probably so, yes.
Not the sounds you want to hear. So, it is important. How did you know what to tell the medical professionals? Just, I mean, he's sick, but I mean, how did you describe to them that what?
Well, I told them that you were acting very different. I felt like you were very out of it, delirious in a way because you were saying things that didn't make any sense. Your speech was very slurred, which your speech is normally a little bit bad, but I couldn't understand a lot of the stuff that you were saying. And I can normally understand you really good. The fact that you couldn't move your legs, because I did manage that morning to get you up and out of the bed, and your mom and I got you to the couch, but your knees were buckling. They had no strength at all. So we knew that between her and I, we could not get you down the stairs to get you in the car. So we said, sit down, we're going to have to call an ambulance. And I told him, I said, he is not breathing normally. He's very exhausted. He is extremely, saying he has a lot of pain and he's just not himself. I mean, I know, like I said, I've learned to see what the MSA is doing to you on a daily basis, but this was just extremely different by your actions, the way you were behaving was very different.
Yeah, I remember being at the top of the stairs, and like you said, my legs were giving out, and I remember I said I can slide down the stairs.
Yeah. You said I can sit on my butt and go down the stairs. And I was like, no, you're going to fall and it's going to make things, no. Yeah. You definitely didn't want us to call an ambulance, but we had no choice. At that point, we couldn't do any more. We couldn't, between your mom and I that morning, we got you as far as the couch. I got you dressed, but that was as far as we could go. We couldn't do any more. I didn't even get you completely dressed. I just wrapped you in a blanket. I was like, yeah, that's it.
Yeah, I got my favorite hat and my slip-on shoes from your mother.
Yeah, it was cold that day, so I made sure you had a hat, a blanket, and yeah, that was it.
So hitting the lungs, MSA hitting the lungs means it has now reached your spinal cord. Now it's just not brain damage. The neurons, the glial cells, the sheathing, you know, what protects the cells. Now it's spinal cord damage is why these lung problems happen. How do you go about kind of a personal question, very, very maybe hard to answer, but how do you wake up every day and look at me and make sure, how do you know I'm okay before you go to work and not like this? Knowing that we just had two instances where blown pneumonia with zero symptoms except I can't move.
I try to talk to you in the morning before I go. I try to give you your coffee and your toast before I leave. That way I can get at least a few words and, see how you're feeling and see how you're acting too. And I even watch you walk as you're walking, as I'm getting you dressed out of bed. I see how you're moving. So I've learned to see what is a normal for you. It's not normal. Obviously, it's not normal that I have to dress you. It's not normal that you walk sideways, that you're falling sideways. I walk behind you and grab you. But I've learned what's not normal for you. So if I see anything different as far as how you're walking, your legs are buckling more, your feet are swollen, then, I'm like, let's check your blood pressure, how are you feeling? And I ask questions, but it's hard. I mean, it's hard waking up in the middle of the night and you're moving and doing stuff or, or your machine is out of your face and I have to put it back in place. It's hard, but I've learned what your normal is because I'm with you every day. So I know what's not normal.
Yeah, it's the stem cells we had in Mexico. Well, I had, but we went to helped out an awful lot. And like I said in my last YouTube video about this week, I said, the surgery flat out knocked the progress we had. Not everything, because I still go up and down stairs and my knees don't buckle. My legs feel strong. I just have trouble with the coordination now. It's like it's starting over again, like a year ago. It actually gave me a year to 6 months of going back a little bit with
To me, it's kind of like you're back to where you started when you had the stem cells. Like, I feel like this right now is where you were before the stem cells, where you were walking sideways and falling sideways and stuff like that. I have not seen that in a few months. You even stopped using the cane. So you weren't using that for a couple months and you're back
yeah.
to it again, and you're back to walking sideways and getting tired when we walk in the store, even for a few minutes. Your feet are swollen. That's something new. So when I ask you in the morning, how are you feeling? It's not necessarily, oh, I'm happy and, chipper. I want to know how you're feeling. I want to hear if you have any new symptoms because that's the only way I can tell. If I see something different, then I wait till you tell me to see if it's, if it's something or if it's just that you're tired or that's why I asked, do you feel tired? Does your arm hurt more? I've learned to ask questions and just watch you. And I know you now, so I know what's normal for you with this disease. As it's progressing, I learn now you can't do this or, you can't do certain things, but I also see how you eat. I watch you all day, all night. I watch you. So I see your patterns and when a pattern changes and I know something is not right.
That's a great observation. I would ask for those that are listening or watching. What's the most important? What's your top three things you look for in me every day to see to make sure I'm like not going down the wrong pathway?
Your speech, because I can tell when you're sick, the first thing that goes is your speech. You start to slur really bad. Also, you're walking, you don't walk straight. Your legs are not straight, they buckle, and you go sideways more. So your gait is just off. It's just completely off. And tired, you just look more sluggish.
Kind of goes with well with what the pulmonologist said this morning, but that would be another video. We'll have to speak about the good, the bad, and the ugly. I don't think there is much good with MSA, but uh, our pulmonologist in IU today basically said, you're gonna have to make do with what you got. The way he said that, I was like, yeah, that's pretty
Pretty
much
much.
us. Does anything make it worse or better? Do you think?
Yeah, when you're tired or when you're walking and you get tired, I mean, you get tired super quickly, and I feel like you just go down. Or any sort of activity that we have, if we go out to a dinner per se, the next day it just takes all the strength out of you. Like being social, seems like it stresses you out and it wears you down. Whereas when you're at home, you're more calm. You're in your own environment. If you're tired, you go to bed. But it seems like when we go out or you do any activities, it just takes a toll on you the next day. I already know. If we go
Yeah.
out today, tomorrow Dave's not going to be out of the chair or out of the bed. So yeah, activity.
Yeah, yeah. Pulmonologist said to me, put your effort where you need it the most, basically.
Yeah, pretty much.
Don't be wasting strength. Anything that makes it better. I mean, I I hate waking up early, and yet somehow, some way, my brain is making me wake up every morning for coffee and toast. I pray I've woken up early enough before my wife leaves for work to get coffee and toast because it's the simple things. I can't make my own pancakes, and me spreading butter and jelly on toast is impossible. Well, stirring the coffee is impossible. Spreading butter and jelly, I might be able to do that, but I'll probably burn myself too. So, is there anything that you know of that makes any symptoms better
I wish I
besides,
did.
besides stem cells?
I mean, yeah, stem cells definitely helped you, but I mean, I wish I did. I try my best every day to make sure you eat, make sure you take your medicine every day, morning and night. I don't know that there's anything that makes it better.
I'd say probably the more caffeine the better.
Not sometimes it doesn't help you though. Sometimes you drink
No,
coffee and go right back to sleep. I mean, you tell
yeah,
me after you go to work, I go to sleep. I just woke up for coffee and toast.
I do. There's something good when you yearn for something at 6:30 in the morning after that you didn't after 23 years.
That is funny.
I will say at this stage of MSA, you start to appreciate the little things. And the coffee and toast is maybe the least for you, but it means a lot to me. So I do appreciate it. I mean, and you make the perfect toast after we adjusted the setting.
Adjusted the machine.
Absolutely fabulous. You just have to work on the raspberry jam. That's something a little different. Well, any advice you would give for my last question, any advice you would give to caretakers or spouses of or partners of patients with MSA as to look for? Like me, of course, we have, like you said, more slurred speech, pain, not moving. Are there any other symptoms or anything else that I'm asking this question because my pulmonary is so horrible. It's day by day. Literally, I don't tell people that, right? We went to an event and people asked me about my breathing machine. I told them it's the machine that keeps me alive day by day. So for me, there's certain symptoms that are very clear. What advice would you give to any caretaker or spouse to say for getting ahead, paying attention to symptoms to say that seeing that their loved one might be getting in trouble?
Any caregiver, anyone that's taking care of their spouse or whoever, I just recommend that they pay attention to their daily activities because anything that you do different tells me that you're feeling different. Even your temper, sometimes you're more irritable. And I know that you're not feeling well, not necessarily, you taught me that. Don't take it personal. It's nothing against you. But if you don't feel good, you're going to be more irritable. And like I said, just watch, literally just watch. I just watch you. I sit there and watch you, how you're eating, how you're holding your spoon, how you're struggling with certain things, walking. I walk behind you all the time and I'm watching you, so pretty much just pay attention because everybody with MSA, unfortunately, there's not a step by step, right? Everybody's different and everybody gets affected differently. So I can't tell somebody else how their patient is going to be doing. I can only speak for you because I'm with you 24/7. So just pay attention and then you'll be able to tell those little changes. Oh, today he's not moving much. Today he doesn't want to eat. Today he is shaking more as he's taking his spoon to his mouth. Just watch. Just watch. That's it. And
Yeah.
ask questions. I ask questions. Every morning I ask you, how are you feeling today? How's your arm? How are your legs? Does this hurt? And and I do it because I want to know before I walk out the door. And then I'm constantly asking you when I'm at work, how are you doing? Do you need anything? Blah, blah, blah. But being with you, I just pay attention. And that's the only thing that we can do because your symptoms go from doing fine to a couple hours later you can't move, or you can move and in a couple hours you're like, oh, I'm fine, let's go to the store. It's like day and night. So just watching your loved ones and watching their changes and how they're acting, and not just how they're sleeping. Sometimes you're sleeping all day and I can tell that you're not feeling well because you don't normally sleep all day. You get up, you watch TV, you move around. And when you're just laying in bed all day, then yeah, I worry then and I pay more attention. I check your temperature, check your blood pressure, make sure you don't have anything wrong. I ask you about your urine. If you're having any problems, make sure it's not a UTI. So I've kind of learned what has happened in the past. And so I ask those questions.
That's true. You see that. Yeah, you see what we thought was UTI or kidney infection. Hospital had no idea what it was, but kind of followed very similar pain and couldn't move.
Yeah.
And
Yeah.
yeah,
They
so
never checked
hospital.
your chest there though. They checked just the urine because we thought could be a UTI, but
Yeah,
yeah, so just watch.
I'll say it's ironic, and I say this: grow up and you learn from your parents what to do and what not to do when you get married. And I thought about this just as you were speaking to pay attention. When my father died in front of me in my arms in 1999, when I was 19, he woke up and his speech was belligerent. Had no the only words that he knew what I was saying was Coca Cola because he loved Coke and Tootsie Rolls because he stopped smoking, eating Tootsie Rolls. Other than that, his speech made no sense because he had many strokes that night and then followed by a massive heart attack, which ultimately killed him. As we come to find out, but we as a family never called the ambulance or I was calling his doctors, but this is before everyone said just call 911. This is way you call 911 and they say call your doctors. It was a different time in the 90s. We as a family did not make the phone calls. I tried to make some in the morning, and I spoke to the doctors, but they didn't get back to me. But we thought that his behavior of incoherent speech and his weakness and whatever was no issue because he's had it before. He was doped up on Vicodin, morphine, and he took like 64 pills a day, something like that. He had twice the pill bottles I have today. You think I have a lot, right? Those are the days where they gave you tons of drugs for no reason, just to sell them. So it's ironic that we say pay attention for little things. The differences in that morning with my father had no idea because it was exactly the same as before. Taking too much pain medication can do those things to you, right? Right. So it seems like an impossible job to get it right every time, especially when it comes to MSA because everybody's completely different. So I just thought that's very maybe ironic. It's not the word to say, but it really hits home for me because if I would have known better, I would have called 911 immediately for an ambulance instead of listening to their advice and saying call the doctors. We'll give you credit for it. Our daughter Sophia, even Audrey, at 13 years old, they come and make sure they check on me, ask me if I'm okay, and they listen for an answer. And they don't just walk away because dad doesn't really sleep during the day. He might be in bed, but they always get an answer from me. I definitely appreciate that from the whole family. It's definitely helping out. So we just wanted to show you and I wanted to show about what pneumonia actually looks like from MSA. Under none of those pictures or videos where you see me sweating, where you see me coughing, where you see me nasal drainage and mucus, coughing up anything, ear infections, earaches, urine, blood, nothing. I mean, zero. And I thank you again for always taking these videos because it allows others to see that it's almost an impossible job to get it right, what you've been doing, right? To ask the right questions and to do the right thing, call the ambulance, call doctors, call whatever. It's almost an impossible job because normal MSA is just like having pneumonia with MSA. They almost look identical. And I don't know how you do it, but I definitely think you, and I thank you for definitely pushing me to actually take the ride with the ambulance, because I was very against that at the beginning.
I know.
Yeah, I thought I would tough it out. So I'm not going to, after back-to-back pneumonias, I'm not going to be macho and manly about it anymore. I'm going to go back on my
Good.
YouTube videos and say I'm done with those days.
Good.
Because how delirious I was from the lack of oxygen, we won't say publicly. My actions in the hospital, like when you start to lose so much oxygen, you literally lose your mind.
Yeah.
It's not all there. I don't remember half of it
Yeah.
at
I
all.
know.
So
Good thing I got some videos.
yeah, some other videos in a locked folder. All right, Suzy, my wife of 23 years. Thank you for joining us. Any final words before we call it quits?
No, I mean, I'm with you till the end. I'm here. I'm happy to be able to help you. I know I can't make you better, but at least help you to go through this with you and just be here with you. It's not easy. It's not easy at all, but I'm here and I'm happy that I'm able to help. I'm happy that we have 2 daughters that are great and always help us too. So it's rough. I can tell everyone out there that it's rough. Try to take some time for yourself. There's one thing I could advise, to relax for a little bit, because it's being a caregiver to a loved one. It's very difficult. Carrying a
Yeah,
full-time job, having 2 children, it's very, very stressful. It's very stressful and difficult, but I am happy that I'm here with you, baby. I love you. And yeah, I'm
I
happy to be
remember.
here.
I remember rubbing my dad's back and shoulders, his arms, every day for years, like a good part of a decade. And it was a burden. I have strong hands and muscles because of it, but it was a pain in the butt so today we have massagers and things like that. And, back in the day, you never had anything like that. So I completely understand, because me and my sister had to trade days or hours that we would be massaging his body to get
And I
the
know
nerve
your
pain.
listeners don't know, but you are 6 feet tall, about 200 pounds. I'm 4'11", about 135, 140 pounds. So, yeah, it's hard. It's hard to pick you up, to lift you, to even get you in bed. I'm going to have to pick up your legs. It's hard, but I'm getting stronger, so that's okay. It's a good workout.
You can leave me on the floor like that one time. Now, you talk about pain, that hurt. Do not sleep on the floor if you have anything to
Yeah,
say.
yeah. I could not do anything. I couldn't lift you. I could not. All I could do was put a pillow under your head and a cover over you. I mean, I just could not. You were just like, just pick me up. I'm like, I can't. I
she,
can't.
she,
I
she,
physically can't.
she puts a cover over me on the bathroom floor. It says good night.
I had no choice. I had seriously no choice. I just, there was nothing. I couldn't physically, just couldn't do it. But I try. It's easier from the bed.
Yeah, easier said than done.
Yeah.
Well, thank you again. We just want to say we appreciate you, and any of our listeners that are looking for information for MSA, go to Mission MSA online. Their webpage has a lot of information you can use both here at home and at hospitals where you can talk to your doctors. It's been very useful for me in the Daisy page as well.
And be an advocate for your
Yeah,
loved one. You have to fight for your loved one, because some doctors don't want to listen. They don't understand. Nurses don't understand. They don't know. They're not familiar with this disease, unfortunately. And so you just have to fight for your loved ones. You have to be that advocate. You have to make those phone calls. You have to push. You have to fight for them. So that's another part of our job as being the caregiver, the loved one of whoever, is dealing with MSA. We are the ones who understand the disease because we've learned about it. Unfortunately, we had to. So yeah, you have to advocate for your patient.
we did that this morning. We're getting a CT scan of my lungs because all these hospitals are saying I have all these things, these particulates and foreign debris in my lungs, but nobody's doing anything about it. And we're like, can we address the underlying condition of possibly the pneumonias?
Right. Yeah.
And sure enough, we spoke up, and we're going to get a CT and see exactly what's there and what's not there.
Hmm.
And I was very shocked that he said he wanted to do it. I expected a no, or there's no reason for it, but so, for the most part, if you ask, doctors are more than willing to at least meet you
Yeah.
halfway.
Yeah.
Yeah,
And the IU doctors are all wonderful. So
yeah, I love them to death. That's my second home. All
yeah.
right. All right, Suzy, thank you very much. It's been a pleasure, and we'll have to have you on more often.
Okay, anytime.
Next time, definitely when Daisy's here.
Okay.
Maybe Sassy Sarah. All right.
All right.
All right. I'll just see you in
Bye,
2 minutes.
everyone. Okay, bye.
Bye.